So I'd like to call to order the January 22nd meeting of the New Canaan Board of Education. Before we go into our regularly scheduled agenda, I'd like to ask for a moment of silence in remembrance of 10-year-old Nico Malazzi, who was a West School student who passed away on January 14th from complications with the flu. Thank you. Thank you. I'd also like to commend Dr. Lutzy on the well-deserved editorial that came out in last week's Advertiser related to, his handling of this tragedy in the district. We're very fortunate to have a leader that is not only, a true professional, but compassionate in how he deals with all the students and families in this district. So thank you, Dr. Lutzy. All right. Moving on, if we could go to the minutes, and if you could take a look at the January 8th minutes, and when you've had a chance to review them, if I could get a motion to approve those minutes. Sherry, second. Brendan, all those in favor? It's unanimous. Thank you. All right. You all have in front of you this evening's agenda, and I would just like to request to make one change to tonight's agenda. If we could move the Saks PTC donation, the science grant, to right after or right before reports and recognition, so after comments from the public. If I could get a motion to Penny?
So moved.
Second. Brendan? Second. All those in favor? It's unanimous. Thank you, and I know Melinda thanks you. Okay, and if I could get a motion to approve the amended agenda. Jen, second. Hazel, all those in favor? It's unanimous. Thank you. Okay. Moving on to comments from the public. To ensure the public's right to be heard, the board has set aside time during the meeting for public comments. 2 minutes will be allotted to each speaker and a maximum of 15 minutes to each topic. Do I have anyone who would wish to address the board this evening? Okay, sure, that's great. And if you could just, announce who you are, that would be great. Thank you.
Hi, I'm Karen Willett. I have 2 boys that are 11 and 6 at Saks and West School. Thanks to Dr. Lutzy and the board for your time, your leadership, and your dedication to our community, especially in a week as difficult as this one has been. It is clear that our school's compassionate and professional staff are really a town treasure. I wanted to speak for a few minutes today in support of the work you are doing to evaluate later start times. I'm standing on my tiptoes. I'm speaking today on behalf of a growing group of parents who are eager to see start times for grades 7 through 12 moved from 7:30 to 8:30. In recent months, we've gathered hundreds of petition signatures, including letters of support from pediatricians here in New Canaan who see firsthand our own children's, the effects of sleep deprivation on our own children. We greatly appreciate that the district has added the evaluation of start times to this year's goals. We all now know about the harmful effects of sleep loss. And the American Academy of Pediatrics, the American Medical Association, and the CDC have all issued policy statements about the negative impact of early school start times on student health, student mental and physical health. We realize that the decision to move start times cannot be made in a vacuum. As in every other district that has successfully changed start times, there will be costs, complications, and logistical issues to be resolved. However, as we go through the process of discussing the difficulties, let's also stay focused on the reason we are addressing this topic in the first place, because that extra hour of sleep every day will improve the mental and physical health of thousands of our children. In one of his budget presentations, Dr. Lutzy said that he often gets questioned during the budgeting cycle by the finance people, and I'm paraphrasing here, what expenses can be deferred, what can be done later, and his response in regard to the student impacting expenses is that if we know a program is needed, we owe it to the current cohort of children to implement it as soon as possible. because they will not be able to benefit from it if we defer it. In that vein, we strongly believe that the cost of not acting quickly to change start times is not zero. Rather, the cost is another academic year of sleep deprivation for thousands of our children. Thanks a lot for your time.
Thank you. Anyone else who'd like to address the board? Come on up forward.
Good evening, and thank you again for all your support in our children and our education of our children. I have 3 children. My name's Lucy Dathan. I have 3 children in the New Canaan School District, a high schooler, freshman, and 2 kids at Saks, one who is in 5th grade and one who's in 6th grade. I'm very passionate about this later school start time for several reasons, and I know that there are several people out in our community who are feeling that maybe the people who are looking at this issue are very emotionally charged by it, and it might be an emotional decision. And I think it's passion. Just like you have the passion to make sure that our children are being well educated, I too have the passion to make sure that my children and the children in our community have strong support and also strong, strong sleep and well rested. And so I just wanted to kind of say we are a passionate group, and this is why. There is not just us parents who want to see this for several reasons just to get our kids an extra hour of sleep. There's study after study after study that are saying how important this issue is. In fact, I'm going to sit here and just have a quick read of the American Academy Pediatric Policy Statement from 2014.
There's like 30 seconds
We as a
left.
community did not invent this issue. This has been around. The American Academy of Pediatrics recognizes insufficient sleep in adolescents as an important public health issue that is significantly affecting the health and safety as well as the academic success of our nation's middle school and high school students. Although a number of factors, including biological changes in sleep associated with puberty, lifestyle choices, and academic demands, negatively affect middle and high school students' ability to obtain sufficient sleep, the evidence strongly implicates earlier school start times, i.e. before 8:30 a.m., as a key modifiable contributor to insufficient sleep, as well as circadian rhythm disruption in this population.
Thank you. It's been over 2 minutes. Thank you. Okay, next person. Would like to address the board? You could state your name. Thank you.
Dear Board of Education, thank you for giving me this opportunity to share with you my observations and opinions. And Karen and, sorry, didn't catch your name, already talked quite a bit about the medical background, the medical research that I was going to chime in, so I'm not going to repeat, but combining the most authoritative research between the published on JAMA, New England Journal of Medicine, and AAP, all indicated, and CDC and American Association of Pediatrics all supported the 8:30 start. But I just want to share a little bit of my own personal observation. I have a 12-year-old in 7th grade, and my 8-year-old hasn't gotten to that point yet. When he was at my 12-year-old, when he was at West School, I used to wake him up around 7:45. And then when he moved to Saks at 5th and 6th grade, I woke him up at 7:15, and it was fine. We prepared him to get ready to the 7th grade early start time, and we actually prepared for quite a bit of time. I found increasingly that he was, as much as he actually followed the wake up very diligently, he's drowsy all the time, and just lack of spirit, and it really took him quite a while to get into his normal self, and it really affect his mood. I noticed the same with my other friends whose children have already been in 8th and 9th grade. Very excellent 15 kids. I mean,
seconds.
diligent. Okay. So I did a little bit research on why this is happening. So the medical research indicate that for teens, the melatonin did not kick in until 10:45 p.m. So I realized that we've been fighting against biology. This is not just about, okay, have them to go to bed early, give them another 8 to 10 hours of sleep, they can wake up early. I just want to bring this to the committee that, that fighting against biology is not the right way to do by, try to reschedule things. So thank you.
Thank you. Yeah, could you state your name, please?
Sorry, my name is Lily Shen, and my husband Hui Liu is here too.
Thank you very much.
Good evening. My name is Megan Steele. I grew up in New Canaan and attended East, Sax, and New Canaan High School. And because of this wonderful community and education system, my husband Jim and I decided to raise our children here too. As a teen, like Tom and Jen and myself, I never started school at 7:30. I'm pretty sure we started at either 8:05 or 8:15, and that enabled us to finish school in time to still participate in plenty of after-school activities, varsity sports, and get our homework done. Last Friday, I emailed to each of you a letter in which my husband and I expressed our keen interest in exploring later school start times for 7th through 12th graders in our town. As parents, we want to ensure that our growing children develop healthy minds and bodies during these critical developmental years. Getting children out the door at 6:30 and before 7 a.m. poses a very frustrating challenge, as I'm sure many of you know or recall. The early wake-up time often results in insufficient amounts of sleep at an age when it is most urgently needed. The kids often leave the house without eating a decent breakfast, depriving them of the nutrition they need to succeed in their academics. Additionally, I know from many people I've spoken with, hygiene suffers as kids will sleep in their clothes, some don't brush their teeth, and some neglect their appearance overall. Given that numerous medical organizations have all publicly issued these public policy statements, which we've all heard about, we believe research on this topic should be immediate, transparent, and thorough in order to make the best educated decisions for our children.
15 seconds, Megan, sorry.
What's that?
It's 15 left. Thank
15 left? Okay, I'm going to skip a paragraph. Relating to your 2017-2018 district goals, we greatly appreciate the many logistical complexities and costs of a research process such as this would cause. And at this stage, we'd like to ask the board if they would address the following questions so all of us as parents of students in this town could gain a better understanding of what is underway presently and what we can expect going forward on this issue. Namely, have you established a timetable for the key steps in this review? When will the research and review be completed? How and when will parents be brought into the process and at what stages? What is the target date for a final determination to be made on these findings? We greatly appreciate your attention to our schools and most importantly, to all of you, to our children. We thank you again engaging in this dialogue and look forward to hearing from you with updates going forward. Thank you very much.
Thank you. Do you have others? Michaela?
Hi, I'm Mickey Porta. My junior in high school just had to fill out a questionnaire for college, and one of the questions was, what has been the most important thing about high school for you? And he wrote, the pain. I laughed, and he said, Mom, I'm not kidding. And I know this every single morning when I have to drag him out of bed at 6. This is a mental health issue. I mean, I see that the high school, all the schools, everyone's knocking themselves out to try to help our kids. Drug counseling, after school activities. We're really knocking ourselves out to try to make these kids feel like this is a warm place. This is a place where everybody belongs. But some days I look at my son and I just feel like He's got 2 arms tied behind his back. It's really depressing for a teenager to get up at 5:30, 6 in the morning, drag themselves to school. Maybe not all of them, but some of them. And it's too late for my junior, but I do have an 11-year-old at Saks. And, you know, even if it's too late for my kids, I don't know. I've just seen this struggle. I'm sure all the parents in this room can relate. So I hope we can really have a conversation about this and sort of get it moving and get an answer. Thank you so much.
Thank you. Do I have anyone else who would like to address the board this evening? Okay.
Hi, I'm Jane Benton. I have a 4th grader at West and a freshman at the high school. Just a completely different perspective and just a personal observation that I had just last week. I watched my son walk down the driveway to the bus stop under the moonlight. I mean, literally, the moon was out. It was pitch black, and he was standing at the end of our driveway waiting for the bus, and the garbage trucks were flying by, and you just couldn't even see them. It's just another thing to think about. It's a real safety issue, having the kids stand outside in the dark waiting for the bus. It's dangerous. So, thank you.
Thank you. Is there anyone else who'd like to address the board this evening? Sure. If you want to take someone else's spot, that's fine. We have 15 minutes to a topic, so that's fine.
One thing I didn't get to mention is really thinking about the link of drug abuse and what this could cause. Because doing my research, I find out that this is not just a problem with us, it's with many districts, that the teenagers, when they didn't get enough sleep, what they do is they really load on caffeine. Just like the opioid abuse issue that, I don't know if you guys followed it, that actually was a cause for the cocaine and heroin usage, that you start with opioid and then you move on to the next one. And when teenagers, they start to abuse on caffeine when they didn't need to, and then it's the next stimulant, then the next stimulant. So I want parents to, and the educators to really think about the underlying connections between those issues. So thanks.
Does anyone else like to address the board this evening? Okay, this will be probably the last on this topic, so
Good evening. My name is Marilyn Harashik. I'm a mother of 2. I have a 9th grader and a 7th grader. I'm also an educator. I have been a supporter of later school start times for many years, probably when the Young Women's League started this movement, maybe like 10 years ago in New Canaan when my kids were 5 and 3. There's been a lot of talk about what the American Academy of Pediatrics, but I just wanted to mention one fact. And that was one item that struck me when I read it, and that was that a 6 a.m. start time for a child, a teen, is like a 4 a.m. start time for an adult. That to me is really significant and shocking, actually. I can't imagine doing that on a daily basis. New Canaan has been on the forefront recently for tapping into children's emotional intelligence. We've been doing a lot of things with Yale, and I think if you ask a kid how they want to feel in school, they're going to tell you things like, I want to feel happy, included, respected, focused, energized, excited. And if you ask them how they don't want to feel, they'll tell you things like sad, lonely, tired, bored. And a couple of those are really directly tied to sleep. So, how can we as parents and educators ignore the facts and not do what we can to help our students be more emotionally ready to learn? And I would like to ask you, why early start times? What is our rationale for that? Why can't we embrace this and move forward? And thank you so much.
thank you. Is there anyone who would like to address the board on a different topic this evening? Okay.
Ms. Carlson, I know we don't generally respond to public comment, but I've asked the board's permission to briefly respond. Thank you. And it is Board of Education policy not to respond to public comments, but I'm speaking for the board first to say thank you to all of you for coming out to the meeting tonight. Certainly there is a strength of idea here, and this is something that many districts are looking at when they look at changing their school start time. You should know that I've been in conversation with our surrounding districts and other superintendents throughout the FCAC, and there are some that have changed their start time, as you're aware. Wilton years ago, and Greenwich just this year. And we're learning quite a bit, both from both of those communities, about successes and challenges and what have you. Karen and I met in DC last spring, where we were both attending a later start time conference, just to begin learning about this a bit. And since then, we've done some work in the district, and we continue to do that work. So there were some questions raised about sort of process. So I just want to address that briefly. The initial stage of the process was to look around at schools that are somewhat similar to our school that have changed their start time and done so successfully, and to look at the indicators that they've collected data on and look for increases, positive increases on those indicators. And we gave them a whole host of things to look at. Unfortunately, not many districts collect data prior to making the change, right? It's not necessarily driven by that. So we did some research and learned some things, but we continue to learn and continue to look for more in-depth research, and even people we can speak with who have gone through it firsthand. There is a complexity to it that is very challenging for any district. There's some districts and superintendents have committed to a certain timeline and then had to back off from that timeline because of the complexity as they've really gotten into this. And so while we resist saying on this date we will have something, what the goal is for us is that in the spring, we come to the Board of Education and speak with them about some possible recommendations for direction. We'll be using the research that we've conducted and other research that we're currently looking at that gets to the operational level and function of the district. There was a question, it's interesting to hear the comments, and I won't go on too long, I can, but the comments about the school start times, but also the standing at the bus stop in the dark. Right, so that almost right there encapsulates part of the challenge because of the way that our transportation runs to the district. We have 3 tiers of buses. So we deliver or transport grades 7 through 12 in our first tier of buses. The next tier is grades 5 and 6 at Saks and South. And then the third tier is West and East. And while the high school starting at 7:30 is early looking at the research, I would say that probably with East and West, I don't think we want to start later than 9:05. It's already tough enough when I call a 2-hour delay. It's to push that out. So you have the constraints of the time and the bus runs, and so that's just one of the operational questions that we're looking to better understand, because that constraint is real. And so some districts have flipped and had the younger students at the bus taking the early bus ride in and starting around 7:30 and having the older students start later. I don't think that's a great solution for us, again, because do we want our little guys and girls standing out there in the dark, and starting their day so early? So we're looking at what some of the options could be. When we come to the board in the spring, we'll have some recommendations for kind of direction, and then share with the board how we reach those recommendations, and then we will take our direction from them as far as next steps go. We did put together a committee, a district-wide committee with principals and teachers and athletic director, VPA director, central office staff, other folks, all different sort of internal folks that they can bring their expertise together to identify what possible constraints can be so that we can be sure to address them in whatever recommendation we make. We try to be very thoughtful and deliberative when we're talking about something as significant as this, because it does impact every one of our over 4,200 students, every one of our over 5,000 parents, and really the whole community. And so when I think about schools, they exist in an ecosystem. So it's not just as simple as sort of just flipping the time. We want to think about the whole system structure that exists around the school and make sure that we can at least consider what the unanticipated consequences could be prior to looking for a direction So that's the work that's been ongoing, and it continues. And so I invite you to, in the spring, when this comes before the Board of Education, we'll also have some opportunity at that point for parents to be involved, to share your feedback, to give some insight into different impacts that you would see. I've been with superintendents from across the country and talked about this as well. Even one superintendent who has just one bus run. He has one school, it's K-12, one bus run, and he was looking to move it from 7:30 to 8:30. He didn't realize how many of the parents cherish the time before school to put their kids on the bus and wouldn't be able to put their child on the bus in the elementary grades because of that later time. And so that gap existed. It was one of those unanticipated consequences to this. So we're trying to identify all of those things prior to making a recommendation. Your being here tonight speaks volumes of the passion you have for this. And I think you're exactly right in saying we do all that we can to focus on the whole child, and that includes the emotional wellness, that includes the physical wellness of our students. So this is all a part of that whole system, and if we can make it better, we certainly will. Thank you.
Thank you. Thank you. All right. So moving on, we are going to have our Saks PTC donation, the science grant, if I could start off with a motion to approve a donation from the Saks PTC in the amount of $6,626.76 for the sixth grade science program. Katrina, second. Tom, is there discussion? Melinda, no, sorry. No, actually, PTC, no, that's great, thank you. I didn't know who was here. I was like, I should have looked up first.
We were going to do the experiment.
All our science buffs are leaving. Hi, my name is Susan Galvin. I am co-president of the Saks PTC along with Kate Van Duzen. We are here, as you said, to request the Board of Ed's approval of a donation from the Saks PTC in the amount of $6,626.76. These funds will fulfill a grant request from the sixth grade science teachers who identified a variety of hands-on tools that will enhance learning and align with the next generation science standards that have been set in place. The items that were requested will help better understand ecosystems, and they are pH sensors and charging stations, dissolved oxygen probes, moisture sensors, and CO2 sensors. If you would like to know the ins and outs of those items, Melinda's here. You don't want to see me stumble over those descriptions. The PTC welcomed Melinda Meyer to our December executive board meeting to discuss the rationale behind supporting the science grant. As a result, we were impressed with the extension of learning that will take place with our investment. The funds will help take sixth grade science students to the next level of comprehension and promote active engagement. Thank you.
So yet again, I want to thank, on behalf of the entire board, the Saks PTC for this very generous donation. It has been unbelievable, the amount of money that this group has raised to help further the education of the students in the district. So we thank you, for all your efforts.
It's our pleasure.
Any other discussion on the donation? Seeing none, all those in favor? Right, it's unanimous. Thank you,
Thank you.
ladies.
Thank you.
All right, so we will go back to reports and recognition and our statement of accounts for the month of December with Dr. Keating.
Thank you, and good evening. You have before you tonight the December Statement of Accounts, which represents the first 6 months of the fiscal year. To date, we have spent 41% of our budget, encumbered 51.4% of our budget, for a total of 92.4%, with 7.6% remaining, or $6,673,947. Of that amount, approximately 2/3 of it is for variable salary accounts that are paid on timesheets and such that will be coming onto the books as we go through the second half of the year. This report does contain a few transfers, and it does align with the reforecast that's in the budget book. So I'm going to go through them briefly for you. So these transfers are between the major object categories of the budget. However, I would mention that we have a total of 660 active accounts in the budget that we reforecast, and we cluster them by object category. So what you're seeing here tonight is the transfer that represents about 0.3% of the budget, the total budget, which I think we're getting closer and closer to reducing the transfers between the major categories through this process that we have. First, the salary account has available funds of $222,537, and that primarily is coming from a few different sources. The certified staff is 2 FTEs under budget, so that has helped us in this current year's budget. In addition, we have about $110,000 that we've saved from 3 teachers that are on LOA. Their replacements are coming in at a much lower rate than their salary, so that has saved us money in the budget as well. But as you look through the various salary accounts, you're going to note that there is pluses and minuses, which happens from time to time throughout the salary accounts. And the bottom line is that we have $222,000. The good news is, for us, is that we did have that because we do need it in other accounts throughout the budget. In the employee benefit account, we have a need for $16,185, and that is coming from an increased need primarily in unemployment taxes, and that is just a function of people who leave the district through the course of the year that apply for unemployment and are eligible for those benefits. We have budgeted at the historical rate, but we are exceeding that this year. And you'll notice in next year's budget, we actually brought that number down to reflect more of a historical average for the district. Moving on to contracted services, we need an additional $19,288 bottom line. We had some savings in the account that helped us mitigate some of our increases. For example, 2 of the interns that were budgeted at the high school, we were not able to obtain. That's a $30,000 savings in that line item. Legal fees, we reduced by $40,000 in the reforecast based on our current expenditure pattern. And athletic events are costing us $23,000 less. On the other side of the coin, we needed money in outsourced services for special needs students and some other athletic-related referee type of accounts. So overall, the account is balanced down to $19,000. With regard to property services, this is the account that required the most additional funding at $116,205. And the biggest item in there was the electricity account. We reforecasted it out. Bringing back on Saks in the auditorium is costing additional funding. And we had, fortunately, we had dropped our electricity account in the budget process because of a decreased rate, but the additional consumption figured into the increased need in this account. In addition to that, we have $31,000 that we needed to pay for monitoring our security system for the cameras, and unanticipated repairs in facilities, $45,000. Under purchase services, we needed an additional $114,887. And this relates to tuition out of districts for our students and transportation. So those 2 accounts required additional funding. Then with regards to the supply equipment and other accounts, I've kind of clustered those together. There is a $14,909 increase there. You will see a flip between equipment and supplies for non-consumable items, which was noted in the budget process as a change. And that's really for things that used to be purchased under equipment, such as rugs and file cabinets and items that really cost less than $1,000 or a couple $100 each. We moved them from equipment over to supplies. And then finally, the fee and other support account is increasing in terms of revenue, and that is directly related to additional kids and the typical students in the preschool program.
Thank you, Dr. Keating. Are there any questions from anyone on the board related to the statement of accounts? Brendan?
Can you just give us a sense as to how the 0.3% compares to past years at this point in the year, budget versus actual?
Sure. My first year.
If you have it off the top of your head.
Well, the first year it was significant in terms of the transfers that took place, especially in the salary accounts. There were like 1.5 million being moved, and we actually ended up returning 800,000 of that to the town, a little bit more. Last year it came down closer, it was around 1%, and this year it was surprisingly enough, and we were pleased because there's a lot of moving parts in the budget, so it can go up over 1%, but less than $500,000 is pretty
Right,
good.
yeah, that's great. Thanks.
Sherry?
So Joanne, I just wanted to confirm that the salary differences are incorporated into the 18-19 budget? So the
Yes.
LOA, the lower replacement for the LOAs and then the FTEs down by 2?
Yeah, so we do start our base with our existing current FTEs, and that's what we build the budget off of. When it comes to the LOAs, they actually work differently on the subsequent year's budget because the teachers are coming back. So while we save the money this current year, we're going to have to spend it next year when they come back on the payroll.
Thank you.
Other questions? I had a question. Could you go into the custodial overtime, the $100,000 overtime?
We do have a significant amount of overtime required in the district, and we are currently using a new tool to monitor that and categorize it by reason. Now, last year we spent close to $500,000 in overtime. We were optimistic when we put the budget together for 17-18. We anticipated bringing back a lot of people from workers' comp. We still have 3 people who have been out this year. And that combined with the use of the schools really generates a lot of overtime. So that's really where we're coming from, but we want to get better at budgeting this line item, to be honest with you, because it is a very complicated amount of transactions that go through the account, to be honest with you, and there's 20, 30 reasons why we work overtime on any given night, especially in this building here, with all the events that take place with athletics, VPA, and just regular stuff that's going on. So we're using this new system called Overtime, and we're hoping we plan to get a handle on this account. And if it is $250,000 a year that we need, that's what we're going to budget. If it's $350,000, that's what we need to budget. But we really need to get a better handle on it. And as it stands right now through the year, especially with the SACS project this summer, we incurred $40,000 plus just for that move and all the moves that were taking place. So that's why we're asking for the $100,000 right now.
Yeah, we've been in SACS now, and it seems like a long time ago, but it was just this summer that we had all the 70-plus classroom moves, and our custodians were really key in all of that. So it does add up.
Darlene, can you just speak to the outsourced services? Is that the 114? Is that related?
Well, it's part of that is special ed, and those are services, I believe, speech, language, those types of services,
Okay.
needs-based. And then another piece relates to services through the athletic department that we brought back in.
Okay. Okay, Penny?
So are the increased special ed expenses partly due to the increased incidence that has been reported to the Board of Ed in the past? So it's not unexpected that we would have some transfers in that regard?
Typically, around the middle of the year, we begin to see an increase in the needs of students in terms of different programming for the last 2 years. This year, we're unfortunately continuing in that pattern.
Are there any other questions from the board? Okay, so, okay. All right. If there's no other questions, we'll move on. Thank you, Dr. Keating. All right. The next item on our agenda is the 2018-2019 Superintendent's Budget, the second read. We have a motion on the table currently that was the first read of the budget that occurred on January 8th. So, Dr. Lutzy, do you have more?
Oh, we have some more, yes. And we have Joe here as well, I believe. Yes.
Yes, thank you.
Sure. So with Joe, why don't we allow Joe to run through an update. As you recall, I'm sure, Joe is our insurance consultant. He's been doing some very good work for us and working through some modeling and projections for us in our budget development.
Good evening. Thanks for having me. So I thought it might be helpful to put together a presentation. Okay? Oh, I can do that from your stand, I guess, right? No, it's remote. Great. So I thought it might be helpful to put together a little presentation on how your plan operates. You're a self-funded plan, and so what does that mean to you? And why is that important from a budget perspective? So the first few slides are not going to have a lot of numbers on them. They're going to try to explain to you what a self-funded plan is and the steps that you need to consider when budgeting. And then we'll get into kind of the numbers and what that means for the budget going forward. Okay? So on the first slide, we're going to talk about just in general what a self-insured plan is. What a self-insured plan means is that you are your own insurance company. New Canaan Public Schools is responsible for any claims that are incurred by your employees or the retirees that you're obligated to provide coverage to, and any of their applicable dependents. We do not pay Cigna. Cigna is our administrator. We do not pay Cigna a premium to administer your plan. Instead, we pay Cigna an administrative fee to help us administer the plan. So we have access to Cigna's provider network, for example. Cigna adjudicates all the claims that are incurred by the plan. Cigna answers your customer service calls. So we do pay Cigna a fee to do that, but you are liable for all claims that are incurred against the plan. I'll talk a little bit about some stop-loss protection as well in a minute. So you hold all liability against the plan. You don't pay any premium to your vendor. You do pay the administrative fee to Cigna. You do purchase stop-loss insurance. Stop-loss insurance protects you against what we call catastrophic, typically what we call unknown catastrophic claims. And what we do at New Canaan is you have two levels of stop-loss insurance. You have an individual stop-loss, an ISL, individual stop-loss insurance. That covers any one individual who has claims that exceed $300,000. Now that's a variable number. That's the number that you've chosen to pick, 300,000. Some groups might be smaller, some groups might be higher. Not a lot of groups are higher, but some groups could be higher. You tend to have a higher stop-loss protection. And that counts medical and prescription claims only. You have a small vision plan, you have a dental plan, those claims don't go against individual stop-loss, just your medical and prescription. And we'll talk about that when we get into the projection part as well. You also purchase aggregate stop-loss insurance. Aggregate stop-loss insurance covers if one of the things that we do is we come up with a claim projection. How much are claims going to be for the next year? We then purchase insurance that says if claims are higher than what we expected, we buy insurance to protect against that. So you purchase insurance, aggregate stop-loss insurance at 125%, meaning if claims exceed, if they hit expected claims at 100% and then go over another 25%, you're liable all the way up to that 125%. Any dollar over that becomes the liability of the vendor, okay? That becomes important for you, particularly in New Canaan, because of the way you reserve, and we'll talk a little about that in a second as well. And just note, you did increase your aggregate stop-loss last year due to some complexities when we were marketing the plan. Your policy and your past practice has always been to have aggregate at 120%. The hope and the goal going forward is that we'll return to 120% as we kind of remarket the stop-loss insurance. But so right now you are 5% higher than you typically have been in the past. On the next page, as a self-funded plan, claims are variable, and they could be greater or less than what we project, right? So we're doing projections now for your next plan year. Your next plan year doesn't start until September 2018. So we're trying to predict what we think claims are going to be. In general, we can do a pretty good job through underwriting processes to do that, but there are times where we're not always going to be right. In fact, we'll never be exactly 100%. So sometimes we'll be over, sometimes we'll be under. So that claim projection is a variable projection. And it's something that kind of moves throughout the budget process as we go along. It also moves throughout the fiscal year once you start. And that's an important piece of what Dr. Keating and I work on throughout the year. Administrative fees, so the fees that you pay Cigna to administer the plan, the stop-loss premiums, those numbers are relatively fixed. The reason I say relatively, if you have changes in enrollment, if you have fewer employees or new employees throughout the year, your total amount will change a little bit. But in general, the per head cost that you pay stays the same. That doesn't change throughout the plan year. Another very important piece of being self-funded is to hold reserves. And reserves protect, they do three things really, two things really mainly. The main thing that they do is they protect your general fund in the event that claims are over expected. All right, so if you only budgeted to meet the expected amount and claims come in 10% over expected, you're protecting your general fund by having reserves available to offset any claims that come in higher than expected. Reserves also are in place from an audit perspective. Your auditors, when they review your books as a self-funded plan, require you to have what we call the IBNR. It stands for incurred but not reported claims. What those claims are is if you think of an employee who might incur a claim on June 15th in your fiscal year, towards the end of the year, that claim might not get submitted and paid until the next fiscal year. The auditors want to see that in your reserves, you have an IBNR, you have those claims reserved to pay for any claims that weren't incurred against the plan. In theory, that only comes into play if you went out of business, which is not likely to happen for a public school. But that's really what that number's trying to say, right? You've made a promise to your employees, to your retirees, that you're going to provide them coverage. And at the end of the fiscal year, you need to have funds available to pay those claims that were incurred against the plan year. In practice, you don't use those IBNR dollars to actually pay those claims. So when we track claims, we're always tracking claims by when they're paid, not when they're incurred. So when Dr. Keating is showing you expenses out of your health fund, those are actually when those claims are paid. So in July, for example, we might be paying claims that were incurred in June. She's using your July fiscal dollars, not the June fiscal dollars. The IBNR is there just to show you have the money available. You have a specific policy on reserves. Dr. Keating can probably do a better job explaining it than I can, but that's a policy that you've come up with over time in conjunction with the town. You've set your stop loss levels based on that policy. And in particular, your aggregate stop loss has a component to the reserve budgeting, and is another reason why I want to kind of get that down to 120%. But you do have a specific policy on reserving that we do need to follow, and reserve dollars that are left over at the end of the year, if they're not to where they need to be, that creates an additional burden on your budget. If they're over where they need to be, that can put some relief onto your budget. Okay? Budgeting for cost. So the single biggest driver of costs is claims. So in our current projection in the last few years, claims are going to be over 90% of the total cost of your plan. The administrative components, while I don't want to say they're small, but as a percentage, they are relatively small. The biggest chunk of cost for you are claims that are incurred by your employees and your retirees. As we start this budget process, so we're starting this process now, we've looked at claims through November, a little bit looked at claims through December. We're trying to predict what claims are going to be over a year from now. Lots of things can happen over the next several months. So when we start this process, often what will happen is the budget process might change. We really try to not ever have it go up. That creates significant problems for you, as you're all aware. We don't like it to go down significantly either, right? We try to be as close as we can. But in general, as claims come out and we get more claims, newer claims, fresher claims, we're getting closer to what we're trying to predict towards going forward. We can do a better job of being a little bit more accurate. So right now we're at claims through November. We'll talk a little bit more about that later. But as claims come up throughout the budget process, we'll keep looking at what that claim number is going to look like for the next fiscal year. Other things that impact the budget besides claims are market trend rates. So we use Cigna as our vendor. Cigna provides us with an annual trend rate. That's not a New Canaan specific trend rate. What trend does is trend looks at the market and it says, what do we think is going to happen in the market based on utilization and cost? So how much are services going to go up? What kind of utilization changes are we going to see? Unfortunately, people get older every year, right? When people get older, they use more services. So costs go up just because we're utilizing more services. Technology, right? New technology replaces old technology. That's typically more expensive. So we create an annual trend rate that we use to predict costs going forward. Again, that tends to be a market trend rate, not a New Canaan-specific trend rate. Over time, sometimes we'll make adjustments based on how you perform against that. But since I've been working with you, there really hasn't been a need to use a specific New Canaan trend. Other market influences that can impact your projections going forward are any state mandates or federal mandates that might come in. When the Affordable Care Act passed and it provided coverage for children through age 25, right? In that year, we made some adjustments to our assumptions saying, hey, we're gonna have a lot more people on the plan that we don't have today. We need to adjust for those. So changes in what's covered, either you're forced to cover or what's happening in the market will also influence your cost. Large claim activity has a lot of impact on your costs. And when we talk about large claimants, I have a slide in here for this, but when we talk about large claimants, we really look at claimants that are over $50,000 and how that impacts your costs. And we'll point to that in particular in a minute. Changes in enrollment. As we have changes, increases or decreases in enrollment, that's going to increase or decrease our cost. Sometimes we see a decrease in enrollment, but we don't see costs go down because sometimes maybe the healthier population is leaving the plan, and those who are utilizing the plan are staying on the plan. So we don't see a drop in coverage, but we need to watch the enrollment changes. Changes in the current year actual claims. So as we're looking at updated claims, are things improving? Are they staying the same? Are they getting worse? And then future plan changes. As you negotiate with your unions and we make plan changes, that impacts the overall projection going forward. So when we actually start the process, there's an underwriting process we follow whenever we're doing projections. And for the most part, they're usually the same everywhere you go. There's some little tweaks here and there, but it follows these kind of simple steps. First, we look at what we call the experience period. And nowadays, it used to be we used 2 years of experience. For the last 10 years, we haven't done that because, to be honest with you, claims are so big now, your pool is so credible, we don't need to look at 2 years. The most recent 12 months of claims is really the best indicator for what the future for the next plan year is going to be. So we look at the most recent 12 months of claims to help predict that next plan year. I'll talk more about that in a second. We then make a large claim adjustment. So when we look at your claims, we look at what we call the gross claims, all the claims that were incurred, even those claims over stop loss. When we look at those, we also want to say, well, we know we're going to keep our stop loss plan. So if we're going to keep our stop loss plan at $300,000, we only need to be concerned about liability up to $300,000. So we adjust for large claimants. And what we do here in New Canaan is we take out anybody who has incurred $300,000, and then we'll add them back later at the $300,000 level. And I'll show you that in another slide. That creates our net paid claim number, right? So we take our gross claims, we take out large claims, now we have net paid claims, and that's going to be the basis for our calculation going forward, okay? We basically just create a per capita, and we start projecting from there. So once we have that per capita cost, now we get into the trend rate. So again, trend is the medical inflation factor. We use an annual trend. Unfortunately, though, we're not predicting 12 months away. We're predicting 21 months away right now, or 20 months if we use December. So I have to take that annual trend rate, and I have to say, well, what would that be on a 21-month basis? And the easiest way to think about that, if annual trend were 12%, that's roughly it is 1% a month. That's roughly a 21-month trend would roughly be 21%. It doesn't work out exactly like that, but it's close enough. So when I'm trying to do a projection for New Canaan now with claims through November, I'm taking a trend rate that's 12 months, and I have to make that a 21-month trend rate. So as I get closer, right, as I add more months of claims, that trend rate comes down a little bit. In that same example, right, I'd be using 21% today. 3 months from now, I could be using 18%. Okay? And don't worry, trends aren't 12%, so they're lower than that. We then have the effective trend, which is the 21-month trend in this example. We then get a trend to per cap. So I take my per capita, I trend that forward by my effective trend, and I get a new per capita cost. I simply multiply that by my current enrollment, right? Unless we know there's going to be changes in that enrollment, typically there's not a lot of changes. We take that current enrollment, we project that forward, and then at this point, I'll add back all those large claimants that I took out before. But I'm only going to add them back in at the $300,000 level. So for example, we have a $1.8 million claimant in our experience right now. You weren't liable for $1.8 million, you were liable for $300,000. In the projection, before we started, I took that person, all $1.8 million, out of the experience. I'm going to add that person back here again, but only at $300,000. Okay, so I assume that person's going to be on the plan. I assume they'll be on the plan at $300,000. Okay. I add back my large claimants. I make any adjustments if necessary. Adjustments might be future plan changes as you negotiate with your unions. There might be a plan change, so we can take adjustments for that. By the way, this year we will be doing that. And then I get my adjusted projected claims. We then get to the next page, we get to the fixed cost. So here we're talking about admin fees, stop loss, and taxes. As a self-funded group, the only tax you're really responsible for is an Affordable Care Act tax called the PCORI tax. It stands for the Patient Centers Outcome Research Institute. It's not a huge cost. It's $2.40 for every member that's on your plan. You pay that every single year. It goes up a little bit. This is the fee that goes to help fund this Patient Centers Outcome Research Institute, which is the group that's looking at the entire healthcare delivery system. And the idea is that through the Affordable Care Act, with this fee, we'll be able to get better delivery systems in the United States. So that's what this group is tasked for. All fully insured and self-funded groups pay this fee. You pay an administrative fee again, that pays Cigna to administer the plan, and then your stop-loss premiums, both individual and aggregate. We then get a total cost. We simply add fixed costs and claims. And then we have offsets and other costs. So our offsets would be any revenues in. So revenues in would be employee contributions, would be retiree contributions. From the state of Connecticut, you get what we call a teacher retirement board subsidy for any of retirees. Your teachers and your administrators paid into the teacher retirement board. Those subsidies come in. Other expenses that come out would be HSA funding. So most of your all of your employees that are in the HSA plan have agreements that you fund a portion of their deductible. That's an expense to you that gets added on. Okay, so now, real numbers. So I'm just going to basically go through those same steps I just did, but give you some numbers here. So in the first, look at the experience period. I'm looking at claims through November. We did look at claims through December. There wasn't a significant change in those claims. It didn't have a significant impact on the projection, so we're keeping the November projection for now. We'll review once January is available. By the way, claims are usually available by the middle of the month, so in the middle of February, I'll see January claims. So our gross paid claims through November, for 12 months through November, were $14.6 million. That's up 31% over the previous renewal, the current fiscal year renewal that we did. Don't worry, it's not as bad as it sounds. We then make a large claim adjustment. So all those large claimants that I'm taking out $3.2 million on just 4 members. So $3.2 million was generated by just 4 people utilizing your plan. I'm going to back out that entire $3.2 million. That gives me a net claims of $11.4 million. So that's only up 1.8% from the previous 12-month period. So not running so bad. Significant large claim activity, but our net pay claims look okay. That creates a per capita of about $1,400. That's up 6.5%. We did have some enrollment changes. We're now going to go ahead and project that forward. So my per capita, the $1,435 from 1D above. My trend rate with Cigna is 8.25%. That's pretty consistent in the market. I see no reason to use anything but 8.25%. On a 21-month basis, that 8.25 becomes 14.9. So I simply increase the 1435 by the 14.9% trend, and I get a new per capita, which is 1648. I then take my current enrollment. You have 666 active employees or retirees on the plan. That gets me to multiply that by the per capita by 12, and that gets me $13.2 million. And just to note, to be helpful, of the 666 enrolled in the plan, 82 are retirees. The rest are active employees. That's about 12%. That number's a little high, though, because 58 of those retirees are in a Medicare supplement plan. So really, you're only paying what Medicare's not paying on 58 of those. So really, about 3% of your enrollment is a true retiree, meaning an under 65 retiree on the plan. Okay, the others are contractually obligated through Medicare supplement plan. So about 3.6 is retirees that are under 65. So I take my $13.2 million. I'm then going to add back $300,000 for those 4 members that I removed from the projection before. So that's $1.2 million. That gets me to 14,000,004. We then have an adjustment here to make, a favorable adjustment. So we're going to back out $963,000, almost 7%, and that's for changes that we've contractually made with unions over the last year. So we're able to make an adjustment to the claims as most of the, I think at this point, almost all employees, maybe a couple bargaining units left, that will not be on the HDHP plan as of next fiscal year. So, or well, really next plan year, starting in September. So we've made a lot of grounds there. And so that's nearly $1 million that you're able to back out of the projection through those negotiation efforts. We then get our adjusted claims of 13.4, which is up 5.1 from the current fiscal year claim projection, which, if you want to write down, is 12,751,000, I think is the current number. Fixed cost, this includes the Affordable Care Act tax, and we do get a subsidy on some of your RX spend, so that's backed out of the admin cost. It's $241,000. That's only up 2.1%, so that's pretty good. And our stop loss fees are projected right now to $905,000. That looks like a big number. It's up 34%. We're being conservative right now. One of the problems that we have is we use an external stop loss vendor. External stop loss vendors do not like to give us projections until we're much closer to your effective date. Your effective date's not until 9/1. So we're not going to be able to lock in numbers until closer to May. So for now, we're being a little conservative. We also are planning on trying to get the aggregate back down to 120, so we're being conservative there too. Hopefully this number comes down, it's a placeholder for now. Hopefully it'll come down over time as we get closer to the effective date. And again, the tax I've already included in the $241,000. Total cost on the next page, $14,054,000. Then other costs we add into it, it's almost $1 million, $920,000 in HSA contributions, $200,000 in non-health plan expenses. So that would include your group LTD, life insurance plan, and then $2.8 million in revenue into the plan from employee contributions and retiree contributions, and total budget costs of $12,008,000, almost $12,009,000. Real exciting stuff, I know. The number's big, though, so I thought it'd be important to understand how we get to it.
Well, it is very important, Joe, because it's a significant budget driver, for us year over year. And when we have good experience, it's great, and it's, certainly it's beneficial for our budget. But, when we don't, or when these numbers are going up, they're large numbers as we look at it. So I believe in the budget document that we have, the insurance increase year over year is 0.75, Dr. Kinney? Of the overall increase? So I think understanding how the number is developed is very important, and we often talk about stop loss, individual stop loss, other pieces, but I think it's such a significant component of our budget, it's important to understand it. The question about the 125 aggregate stop loss versus the 120 aggregate stop loss. You think 5% isn't all that much, but when you're talking about 5% is that of the overall, is that of the $14 million
Yes.
number?
Yeah.
Yeah, so it becomes a significant amount that has to be reserved in order to account for the possibility of that versus, not. So even those kinds of decisions and discussions are important for all of us, for the board to understand how we arrive at the 3.48% budget request for the 18-19 school year.
So first I wanted to say thank you, Joe. You do an amazing job of explaining, what can be a very complicated subject for everyone. So thank you.
Oh, you're welcome. Thank you.
We're very lucky to have you as a consultant. Why don't I open up for questions first, and then I'll come back to mine. Penny, did you have a question?
So the 12.86 projected for next year, it compares to what for the current year? Because we have employee benefits in 2018 of $14 million, but that includes other items. I was wondering.
I'm sorry?
The
So
12.86 in our current budget, total budget cost for next year, what's the number for the current budget year?
Look on page 16.
So you can find that in the budget document.
Shoot. Okay.
Right, so that's right on page
So you
16.
really have to connect page 79
Okay.
to this page, because 79 basically goes through the fund, and it backs out numbers, it backs out fund balance, and it does a few things in addition to what Joe just explained to come up with our budget number. So if your question is how much is it going up, you'd have to really refer back to page 79. It's under district-wide.
So it's going from 12.751 to 12, no, that's not it?
The 12751 was
That's
a
a claim,
projected
that's the wrong
claim
number.
number, yeah.
It's the bottom.
That was for the current year, though.
Yeah, that's the
That's
current
the
fiscal
current
year.
year, not next year.
Next year's 13.4.
Yeah,
Well, I guess I meant
13.4
current
is
year.
next year.
Right, but to look at what our budget versus, so you're 12.7 versus the 17 actuals is 13.8, right? Is that how we would look at it?
Yeah, if you look at page 79, it kind of gives you a breakdown of all the costs. And you can see the claims number, which is the second category down. For this current year is 12,751,000. That actually was our budget number. And after Joe did all of these calculations, he came out so close to that number, we made the decision not to change that number at this point in time. We really need a couple more months of claims data to really see where it's coming in. And as Joe mentioned, and we've mentioned so many times, our start date for our plan is September 1st. So when we put the budget together, we're only 3 months into claims under an HDHP scenario type of plan, which makes it difficult because people are using their deductibles. So that's why we use the same number for forecasting. Having said that, because the model works off of the prior 12-month claim period, it does influence your next year's claims projection, which are at the 13.4. So that's the difference really that you're looking at in terms of variable cost. The other increase in the cost, as Joe mentioned, are in the area of stop-loss insurance primarily. So you're going to take a look at that, but also the cost associated with moving a lot of our non-certifieds over to the HDHP is going to cost us money in funding portions of their deductible. So that's all lined up on this page here so that you can really see where the cost factors are coming into play. And then lastly, what we do in this fund to come up with our budget appropriation for the general fund is we project out what our fund balance is going to be at year end, and we use anything over that aggregate corridor to offset the increase. So here you can see we're using a total of $853,000 to offset that corridor, which we have budgeted at 120%. So we have made the assumption that we're going to bring it down to 120 based on bidding and based on the market and what's available. And so we're taking some of that 5% that was left in the current year because we had to go up to the 125 and using that already within our projections right now to offset the budget request for next year. I don't know if that helps or hurts, but it's just looking at the raw numbers, and it's hard to really see all the variables without coming to this page here.
And one of the interesting things that make it a little bit more complicated here than other places is you have a September plan effective date. So all the work that I'm doing with Cigna and doing your projection is based on a September effective. But your policy, which is very good, by the way you look at I call it your reserve, it's really your internal services fund that has a reserve component to it. But by using your internal services fund as part of that budget process, you take advantage of any opportunities when claims outperform projections. So if that 12,705,000 becomes 12 million, then you've got $750,000 that you can use to offset future costs. Unfortunately, if it goes the other way, it also hurts the budget process. And to Dr. Keating's point, right now I'm looking at claims through November. I've got 3 months of claims trying to predict where they're going to end in August. And it's really difficult to do that, especially when we have so much HSA enrollment because of the way the deductible works. So as we get closer, March is my hope. I would really love to say May, but March, we can get a lot more accurate with where this current fiscal year is going to end, which then also feeds into the next budget cycle for you as well.
And just as a reminder, the last few years we have had positive claims experience. And as we've gone through the budget process with the town officials, we've been able to basically free up some of those, the funding in the reserves, because we didn't think we needed it as much. And so we're going to go through that process again. But as we talked about it at Resources the other day, this does not appear to be a positive claims experience year, at least not so far, but we're only 3 months into it. So we feel like we need to take a far more conservative approach with the town officials and make sure that we really do have claims experience that we feel are reliable to get us through the budget cycle.
And to that point, it was the positive claims experience in part that enabled us to get to the 1.67% year over year last year. So when we don't have that positive claim experience, we're making up that gap, and then we have to plan what's happening ahead. So I think that's an important point, that we were, able to work through a 1.67% last year, thanks to the positive claims.
It'd be interesting to look at, and not tonight, obviously, unless you have it off the top of your head, and I'm guessing you don't, but what percentage that helped the budget in this last year, as we went back in the beginning of the budget cycle and back, because I think we came in initially much higher than the 1.67. And yeah, so I think we need to kind of speak to that a little more openly, because we do have quite a few. I mean, in sort of our discussions, we have a number of high claimants this year, and as I was sitting through Board of Finance and Town Council insurance meetings last year, and you were there as well, and maybe I think it's educational for the board. You tend to go in cycles with these claims, and we've had a number of very good years of good claims experience, and then you tend to hit 5 years is what I heard. I don't know. Maybe you should.
Yeah. So actually, if it's okay, I'll go to the next slide.
Oh, sorry.
Why didn't it show?
Yeah,
Is it in your packet? Do you have a?
We do have a slide in the packet. Yep.
Okay, it's not showing up on the.
On the back here.
Yep.
So at the back, sorry, audience. Not terribly exciting anyway. But in the back of the packet, what I did is just show you the last 2 plan years. I don't want to call them fiscal years. Last 2 plan years claims, and then the current plan year to date. And I did bring in claims through December here. And so what's really important when we start to look at the health of your plan and how your plan is running is really looking at your catastrophic and your non-catastrophic claimants. In a catastrophic claimant, we're going to call anybody over $50,000 in medical and prescription cost. A non-catastrophic claimant is anybody less than that. And the reason why it's important to look at that is if you think about how you manage your plan through negotiations, through strategy on plan design, through your wellness programs and things like that, we can have a lot of impact on claimants that are under $50,000, right? We can implement plan changes that have impacts on the way people are going to utilize the plan. It's really hard to implement to have an impact on somebody who incurs more than $50,000, right? So if I'm a $50,000 or more a year claimant, it doesn't really matter if I have a $5 copay or I have a $4,000 deductible, right? The cost to the board is still going to be substantial. So we like to look at tracking those high dollar claimants, those catastrophic claimants, and those non-catastrophic claimants. And that's what this sheet tries to do. So you can see on the top there, your total employer paid cost in September 15 through August 16 was $11.1 million. That jumped to 12.3 for last plan year closed, and then currently year to date we're at 3.5 million. In the first column of that, 2.7 of the 11.1 was for high dollar claimants, and the rest, 8.4, was for non-high dollar claimants. In that next year, right? Let's stay at the third line for a second, right? My non-high dollar claimants in 15-16 was $8.4 million. My non-high dollar claimants for 16-17 is $8.45 million, right? So barely any change in my non-high dollar claimants, yet a significant jump, in my high dollar claimants, right? I went from 2.7 to 3.8. And if you think about that, you're not liable, right? You're liable for $300,000 for anybody that goes over your stop loss. But so as we pick up large claimants, right, you're responsible for a big chunk of that. And that had a big impact on the performance of the plan this year. Currently, year to date, it's not real credible at this point, but you've got $750,000 in high dollar claimants and $2.7 million in non-high dollar claimants. That number is going to change as we add more claims. So it doesn't really add a whole lot of information. If we go down a few lines below that, 3 lines below, you'll see 27 members. So what that means is, of that, in that first column, of that $2.7 million for high dollar claimants, that was incurred by 27 members, okay? The next year, last plan year, we had 36 members. And currently this year to date, we have 9. One little note, we're up 3 from November. So we went from, we jumped up 3 from November. So on a percentage basis, it was 1.73% of your members incurred 24% of your cost. The next year, the last plan year, 2.34% of your members incurred 31% of your cost. So you can see where those high dollar claimants really have a big impact. And then below, we just bucket those high dollar claimants. So probably work from the bottom is probably more meaningful. Your largest claimant in 15-16 was $447,000. Your largest claimant last year was $1.8 million. Now again, you were only responsible for $300,000 on both of those, but it does have an impact on your claims. Currently, year to date, our largest claimant's $140,000. And then as you work up, you can see that between $200,000 and $300,000, we had nobody currently, nobody last year, but we had 2 people the year before. Between $175,000 and $200,000, we had just 1 person in both the most recent completed years. So you can kind of see how that's tracking. But we want to watch how those high dollar claimants are impacting the plan. And I'm expecting that the reason we are seeing claims maybe not lead to maybe a favorable offset for this current plan year or this current fiscal year is because we are having about the same amount of large claimants. So we're not seeing those large claimants come down this year. And to the board chair's point, what we tend to see is these 3 to 5 year cycles. We'll see an increase in large claimants, studies off a little bit. We'll see a decrease in large claimants, it studies off a little bit, and we see these cycles of 3 to 5 years. So it might be that we're on a little bit of a 3 or 5 year climb right now, but we'll want to keep our eye on that. And again, it's important because it's $300,000 for everybody that goes over that point to you, right? You're liable for the first $300,000 on them.
Right. So if you were to look at 16, 17, and the fact that we had four over the 300,000, 1.2 million of the of our claims we had to pay for.
Correct.
Because and that was significantly higher than the 2015-16 where we only had 1.
Yeah, and if you think of my boring little step-by-step guide, right?
Yeah.
So last year, I added 1 person back, right, at $300,000. This year, I'm adding $1.2 million back to that calculation. And if you remember at the top, right, the year-over-year net claims were pretty good, right? It was 1.7% or something change. But I then had to add $1.2 million back instead of $300,000. So yes, those 4 people over 300 are impacting the calculation by $1.2 million.
Okay. Sherry.
So just a quick question on the
Yeah.
stop-loss fees. Can you just break out how much of the 34% increase is driven by the decision to go back down to the aggregate 120% and why you feel that's necessary?
So we've assumed the 30% increase on both the individual and the aggregate. So right now it really just is a placeholder. The rationale for going back down to 120% is really twofold. One, it's been your past practice, and it's been really the foundation of how you've budgeted for your reserve, right? So when you take my claim projection number of $13.4 million, right? You then, if you're at 125%, your reserves need to cover 25% of that gap as well versus 20%, right? So if we're able to get that to 120, you're able to take some of the pressure off of the internal services fund, off of the reserve. Primary reason. There's also a reason from a protection perspective, right? And And as a Board of Ed, you have some fiscal responsibilities. And aggregate stop loss becomes very important to you because you're personally liable for some expenses if you don't manage those correctly. And so having an aggregate stop loss at 120 like you've been in the past has been the direction that we've been following.
Right, but it's looking at the cost benefit of that protection, right?
We will look at that, right? And that will be part of the analysis, is what are we buying for 5% more? So we won't just ask for 120, we'll price it at many different levels, but that will be something that we'll look at.
Just to follow up, I had
Penny?
a question about that. So, all right, I should not reveal my math, but the 5%, going from 125% to 120% on the aggregate stop loss protects us against an additional, all right, 67,000 in loss, is that right? Because 10% of 13.4 million, or wait, it's 670,000.
Yes.
I'm a factor off,
Yeah.
670,000, okay.
That's a big number.
And it's not likely that's going to cost
Couldn't be that.
$670,000
I know it's
more.
off, okay.
She's a lawyer, we'll give her
I have Melinda
Yeah.
remedial lesson. So that protects an additional $670,000 for the town. And about what is the extra 5%? What are you assuming the difference in premium will be to protect that fund, those funds?
Hard to tell right now because of the way that our stop loss is structured. We've got individual with Berkshire, we've got aggregate with Cigna, so we're trying to kind of combine those back into one vendor. It would not eat significantly into that $670,000 though. I mean, if we end up with an aggregate stop loss increase of probably 20%, that would be a lot, I think. But for now, as a placeholder, and because we really don't know what's happening with the individual, we've just bumped them both at that 30% level.
Right, so how much did our aggregate stop loss cost last year?
Last year's aggregate,
715.
I have it with me.
It's differently, yeah.
I have them combined. I don't know if I broke them out.
It's around 88.
Yeah, I'd say 90, yeah.
better, yeah.
It's about $90,000.
90,000, okay.
Yeah.
So you think it's going to cost an extra than 30,000 to go down to 120, and assuming that, you're going to have a year-on-year increase anyway in cost, potentially.
Yeah, so, I mean, two things will happen, right? If you stay at the 125, your rates would likely go up because stop-loss insurance goes up. And then you would have an additional increase to buy more protection to go from 125 to 120.
Okay.
The individual stop loss is much more expensive than the aggregate.
Individual is much more expensive and
Right, the aggregate actually has always been pretty cheap.
Right.
Yeah,
Right.
it's
Comparatively speaking.
Comparatively, yeah. No, I
for the
just remember
protection
that
that
from
you
past
get, right?
years.
Right.
Okay.
Yep.
That seems like a reasonable way to go.
Any other questions?
I did have the answer to
Okay.
your question if you'd like it.
Oh, great, thank you.
As you know, we were cut $1 million going into the budget. 500,000 of it came out of the reserve. 500,000 came out of the reserve. And we also took 192 out of our projections for the savings on stop-loss insurance, which came a little bit late in the process, but we took it at the end. So 692 of the 1 million. 0.8%.
Yep. So that 0.8% has to be made up this year prior to any new costs due to our trend.
Yeah, it all falls through the balance sheet.
Right.
So we were close, last year, we were closer to 2.4, 2.5 in the original ask, just so,
Right.
if
But
you.
ultimately, it was 1.67.
Right, but we were able, because of good experience that we found later in the process, we're able, and so, I just want people to understand, when they look at last year's budget, that 1.67 was fully insurance-related benefit to the board budget.
So
Penny?
I think you've spoken to this in past years, but just to remind the board and maybe people in the town, that we have, because we're self-insured, I know we save money as a town because we're not paying an insurance company to take the risk for us.
Correct.
But is there a way that you can quantify how many, over a period of time, how much money the town saves by taking the self-insured route? Because it does bump up and down our annual budget increases.
So in general nowadays, a fully insured plan will cost, and it depends on your stop loss levels. The higher your stop loss, the closer it would be to a fully insured, or farther from fully insured plan it would be. So we would say that in general, it's about 12% more on an annual basis to be fully insured. And most fully insured plans these days do not have participating plans. And so what I mean by that is if your claims are under expected, those dollars don't come back to you. So as a self-funded plan who manages their reserves appropriately, it does a couple different things for you, right? It's saving you 12%, which in theory you're putting into reserves anyway, right? That's kind of the idea. Instead of paying the carrier to reserve, you're paying yourself to reserve. But what you're really benefiting from is that long-term success of, hey, we've outperformed projection this year, and those are dollars that we get to use to offset. It's very rare in Connecticut for a municipality or a school district your size to be fully insured. There are some out there. I don't work with any of them. There might be different rationales for that. Some regional school districts struggle with reserving, right, because of the way their budget processes work. So that could be a good reason why, right? I can't physically reserve, so I want to be fully insured. But a group like you who has a great reserve policy, a great budget process, self-insured is really the way to go. And you manage it well and you follow it well. And we try to eliminate the surprises as much as we can.
Okay. Any other questions?
So Joe, at this point, the numbers that we have in the budget as far as insurance for next year, I heard you say earlier in the presentation that hold steady where we are, get a few more months worth of actual claims, and look mid-February or even into March for if there's going to be an update.
That would be my recommendation. Yeah. So mid-March, I would have February claims. As soon as January claims are available, I'll take a look at them.
Yeah.
But unless there's something really shocking then, I would think February claims would be a really good time to look at it again.
Penny, just one more question. This
Yeah.
is really more a fund design question.
Yeah.
So I know we moved to the September 1 start because then we're funding the HSAs for the employees that we're starting the plan year with, right?
Yeah.
So are there ever, but it does create this, lack of data, so that's to the district benefit, creates a little bit less data when you're putting the budget together.
Yeah, it's hard for the budget process.
Is there any movement in districts and in plans to be able to, do you always have to fund the money into the HSA at the start of the plan? Do you ever have plans where you can fund that money, 3 months in? Or is that just
Yeah,
pie in the sky?
No. The vast majority of contracts now, and it's a little different when you're first implementing a high deductible health plan. In that case, I tend to see that the funding is occurring right in the beginning of the plan year. But most groups now, especially as you're recontracting after somebody's been in a high deductible health plan for some time, you're breaking those contributions up. So most of my clients are July clients, renewal dates. So even though and their plans run July to June. So what they might do for their staff is make a very small contribution in July just to kind of get some money in the account for the employees, make a second contribution in September when people come back to work, so you know that they're here, now you want to give them their money, and then make a third contribution either in January or some wait until March. So there's lots of different ways to fund those accounts now.
Okay,
Yeah.
thanks.
Yeah.
Anyone else? Maria?
Sorry if you answered this already, but what is the per capita cost? So if you adjusted your employee numbers in the budget, would that adjust per capita insurance? Would it change the insurance?
Yeah, so I didn't calculate it on the sheet for you in the presentation, but we do create an overall per capita cost. I don't have the one that has the additional cost offsets, but just looking at the plan year through November, your total per capita, based on that $13.4 million claim projection that I walked through before, would be about $22,000 per employee per year. So that would not include, that's the total cost of the plan. From there, we'd back out the employee contributions. We would add in the HSA contributions. So it's not exactly, but that's what I would look at as, if you're going to hire somebody, what's it going to cost the plan? About $22,000.
Anyone else? Okay. Thank you, Joe.
You're welcome.
Great.
Thank you.
Very informative, Joe. Thank you.
You're welcome.
Makes it so simple.
Wow.
Well, I was just
Very-
wondering if we could all get insurance certificates after tonight.
Yeah.
Some sort of, insurance course completion.
Now that, a CEU for insurance. It is so complex, and it's just got to be helpful for everyone to understand how the numbers are built, and, it's something we're always optimistic about trending downward. We always hope that it does, but, we've got to look at the experience and go with the numbers as they arrive, is what we see. So, thank you, Joe. Very well. Oh, not boring at all. Thanks. So I thought at this point, first let me begin by thanking the team, both certainly the cabinet and the administrators and other staff that are here with us tonight. Over the last couple of days, we received quite a few questions, and worked through the weekend, through the day, in order to put these together for the board. So what I thought we'd do is just kind of work through the questions, and I'll just very quickly read out the question and the response, and then if there's more discussion, great. And if we want to just continue, we'll just continue. We'll just work through these, the questions. I want to thank the team, outstanding work, sort of coming together and responding as best we could as we did this, and thank the board for your thoughtful questions. It was good experience and opportunity for us to dig into the budget in a couple of different ways. So thank you for that. So I'll just work through, and again, stop me, but I think it's good for us to just process together. So, and these are just answered in the order in which they were received. So no other particular order other than that. So what was the cost of the Sean Aker workshop on happiness in August? Just the pre-workshop online learning activities, 2 days hands-on experiential workshop, and ongoing follow-up for 25 administrators was $15,000. Where does that expense show in the 17-18 budget? Funding for the Happiness Advantage came from the staff training account in curriculum and instruction. What is budgeted in 18-19 for this organization? Nothing is budgeted in 18-19 for the organization. However, we continue to receive supplementary materials, and several buildings are hosting book study groups with a focus on student and adult happiness and engagement in the classrooms and beyond. What was the total cost of the administrator training at Yale for the Ruler program? Again, the online pre-workshop activities, 3-day workshop at Yale at the Center for Emotional Intelligence, and ongoing follow-up activities for me, Jill, Darlene, and Susan, cost $4,000. Where does that show in the budget? Funding for the above experience came from the Title II Consolidated Grant. What will be the total cost of implementing Ruler program district-wide in 17-18 and in 18-19? Excuse me. This year, the anticipated cost is $42,000 for staff training and development. This funding comes from the operating budget, Title II, and Title IV. Using a train-the-trainer model, all faculty and staff are being trained as a result of
Dr.
this.
Lutzy,
So that's
can
over
we-
700 people.
Can we,
Yes.
these are all going to be on the website,
Yeah.
right?
They will be.
Okay.
We don't need to read all
I
these.
mean, I don't think we
But
need
it
to go
took us
through
so
these.
long to
I
write
know,
them.
I know.
I know, yeah, thank you.
I was really just
I
warming
know,
up.
I
No,
know, and-
I agree. Thank you for noticing, though, because
Thank you.
with my cold, it would have been very painful. And
It would have taken you a really long time to
oh,
read
we
all
were
these numbers.
we were ordering breakfast, but it really was great work by everyone putting this together. So
I agree.
if the board wants to take a look through right now, and if there's anything in particular you'd like to question us about, we are glad to have this discussion. We also have, again, the administrators and folks here to shed light on anything that could be, that could be helpful for the board.
Sherry.
So First of all, I do want to thank you. These are extensive questions and extensive answers. I also think it's worth noting that this is really a culmination of a nearly year-round budgeting process, and that we do, as a board, have a resources committee that meets monthly to review the budget information in detail. So there's a very detailed ongoing process, and that this is really just, we had our first round of questions at our 3.5, 4-hour budget workshop, where again you had your full staff there available to us as a board to really dig into the details and review the detailed budget assumptions and information. So, and then this is quite a compilation. I want the insurance certificate and the budget question certificate after I read this. But I also want to say, just on the social emotional intelligence, I think as a board, we all agreed and added that to our budget goals. So I'm actually proud as a board member that with pretty immaterial costs, that we're leveraging the resources with Sean Acor from Harvard and the Yale Social Emotional Intelligence, and that we're training our teachers. I think as a board, we've had lengthy discussion about how important this is to our students and to the health and well-being of our students. Thank you, Dr. Bliss, for your leadership on this. So I'm really proud, and I'm glad that these questions were submitted and that this information came out, because I think it's a job well done on an area that we are really leading the way in. So.
Maria?
I would just have to add, I don't think there has been enough time on these topics as far as representing and making sure that we're spending money carefully. I don't know what the cost is all in. We will spend $42,000 this year. The cost next year is not determined yet. So I'm not sure as a board we can just take on things without, we should be voting on programs like this. It's one thing to have a council that meets and puts their heads together and comes up with programs, but the council should not be deciding. We should be deciding. And in this year of economic crunching, I really think we should look at these programs a little more. I think we should look at the schools that have implemented Ruler and what problems were they fixing? What are we looking to fix? Our teachers have been addressing social emotional learning since I've been in the district for 13 years. This is not new. So Ruler, on the other hand, is a new program. And I think we owe it to the taxpayers to determine what the full ongoing cost is of that program, and of whatever is new, we should be asking how much and for how long. What will the ongoing costs be? Will it add staff? We should be asking these questions.
Dr. Bliss, did you want to come over? Yeah, come to the, thank you.
To respond to a little bit of that, I just wanted to let you know that we have been in contact with our DERG schools, and we are working with them and hearing about their experiences going through this. It's not really a new program. They've been at this for quite some time and have really good evidence and research behind the Ruler program. So I'm certainly very excited about this and feel that we're in a good place. And just to also mention, the research is so good about this that at this point I'm feeling like we have to think about the cost of not investing in our kids. And there have just been 3 big studies in the last 6 months that came out, one from Harvard University, one from Princeton, The Future of Children, and both of those studies talking about the importance of social emotional learning with the idea of academics, and knowing that 13% increases in academics when we do teach kids social emotional learning. And while we have had some social emotional learning in the district, what's really different about this program is it's universal. And we're not only focusing on teaching kids social emotional skills, we're focusing on teaching the teachers. And I think that's really a difference when we're talking about how teachers are going to interact with students and that relationship. And we know that that relationship underlies learning. So between the research, the neurobiological research that we know about the intersection and importance of social emotional capacities and self-regulation to learn, it's really not refutable at this point. And I think we would be remiss not to be taking this opportunity. So I just wanted to add that.
Thanks.
Brendan?
Yeah, I just, I wanted to address the comment that we don't have enough time, or we don't have the level of detail that's required. I think we have, excuse me, a frankly shocking amount of detail. I think I've gone through probably 200 or more pages of line item detail down to numbers as small as $1,000, $2,000, a few $100s, and so in that context, it's hard for me to see us not actually someone on our board not feeling that they have the level of detail to make decisions on programs going forward. You combine that with every 2 weeks having meetings on curriculum and understanding really virtually every program that's going on in the schools. If I think about this and just in terms of the context of my job daily, I work in the private sector as a banker. The detail that we go through in my work on a daily basis is not even close to what we do here as a board. That's important. We're dealing with public resources, but I just want the public to understand that the level of diligence involved in this process is excellent, but frankly, to the extent that we take it even further and further and go deeper and spend more time in this sort of a setting with administrators who should be spending time actually, doing the hard work of managing the schools and other staff and professionals in school, I think that will end up doing a disservice to the students in town.
Maria?
I just want to add first about the social emotional learning. I know we've done this. In 2008, we implemented SAPL, Social Academic Personal Learning. The SEL 5 standards were integrated into curriculum. Staff, we have spent money over the years on this. We have addressed it. It has been a goal in the schools. So what I would like to see is how is this new program different from what we've been doing? And I don't really think we've had the level of time that we need for a $90 million budget. We really only got the budget on the 8th. We had 2 weeks to look at it. Questions were just answered. I'm just getting the answers now. So I really don't think other districts do hear presentations, but boards actually vote to adopt programs because they thoroughly vetted them and thoroughly looked at the cost. And so knowing that we don't do that, this is a very short process,
Well, I think you have to step back, and yes, we don't have the numbers, and I know you weren't there, but we had a budget workshop back in December, which sort of all the administrators came and discussed, all that was going to be going into the budget, what was going to be driving that, and we had 3.5 hours to ask questions. And so, I think, I'm not sure if anyone else missed, but that's a critical component to the budget process that I'm not sure you've made either year.
But there were new dollars attached to that
But
meeting.
it drives the numbers that we're going to be pushing in there. And there are 2 weeks, and I understand that some people didn't get their questions in until, the end of this week, but there was 2 full weeks. So, it's up to us. The onus is on us as a board member to take the time to look through the budget and, and carefully peruse it. And, that's what we've committed to the community that we'll do. So, and I would just like to support Dr. Bliss because I did send an email to Dr. Lutzy and I think he forwarded it on to Dr. Bliss because I had done some research, and I was really thankful that I got some extensive research, which I got through some of it, not all of it, I will fully admit, on this social emotional learning and the research behind it. And, it really speaks to what we learned. I'm not sure if you attended Dr. Mark Brackett last year either, but he talked about how, the social emotional skills that we're giving to our kids have direct impact on their cognitive learning. And if they are not socially, emotionally competent or secure, they're not going to be learning the hard facts and data and things that we need them to learn. And so they're all connected. And this research that I got through was talking about how it all is related to how well you do it. So if you take an off-the-shelf program that's kind of given to you and you just do kind of rote, or you check the box, Okay, because I think a lot of districts, because they don't have the abilities we have in our district, they check a box. That's not translating into the cognitive improvements that we're seeing in this district. It's validated by data and research. And so if you if you take the time to do that research and read the research, you'll find, and our scores and our student achievement bears that out. It bears it out. So I think we need to sort of, we're fortunate in this district that we have the ability to have experts that are experts in this field. And I think most of us on this board would agree that we are not experts in this field. And so we're fortunate to have these experts, and I, for one, and will continue to vote that way, is that we allow these experts to do what's in the best interests of our children, because I would not be wanting to make the decisions on those kind of questions going forward. So, any other comments or questions? Penny?
I would just like to say I agree with Deanna. I think that we need to hire the best superintendent we can find. He has to hire the best staff. They have to do dedicated research, seek out the best programs. They evaluate the cost effectiveness, and that we need to look at the results and look at our students and see how they're doing academically, socially, emotionally. You read all the research, you look at the stuff, you see how these kids are under constant stress. And my kids, luckily, they're in their 20s, but I remember the stress. I just babysat for my niece, who's a freshman in high school, and the social media is relentless to this generation of students. And if we don't teach our students early on how to handle the kind of and I think the school districts actually know a lot more about what's going on than parents, because they have 4,200 students talking to them every day. I really think that we need to, in a very broad sense, help our students develop this social, emotional learning ability to become basically the self-confident, productive citizens that we want to create out of the new Canaan students. And this social, emotional part, wasn't really a part of my education. Probably been better off if it had been. But I think it's what you need to do today to prepare these students to handle the world that they're moving into, and certainly, the colleges that they're going to, and all the wild stuff happening on college campuses and everything. Our students need to have a good compass about how to continue to learn. So I support this effort.
Hazel?
I think I'm fortunate to have been an educator and been able to update it through this whole process, because as new things come on, it's very helpful if you can find out what's happening on research, what's happening throughout the United States, what's happening in other countries. Starting first of all with our superintendent, who really surprised me the first time when I asked him about a book that I was reading in education. He not only knew about the book, but had visited the country from where it had come, and knew all the research because he'd seen it and visited in the schools. It's a wonderful thing for us to be able to go and have this type of background with people that are here. Not that we want them to be sitting down and talking and educating us all the time, but just to fill in questions, because there are new things coming in which are so important, which we're now discussing, and I think that other people have been eloquent about why they're important, and I think that we can continue to grow ourselves. I think that if anybody wants to subscribe to magazines or any of the publications that we could pass around to each other, if that would be more helpful, perhaps that would be a way for people who are not feeling that they're not getting enough background to make decisions on some things that we're deciding. But I must say that if you read in the Wall Street Journal or the New York Times, they are carrying a lot of this, of what we're learning and what we're seeing right there, so that anyone that is even in the audience can keep up by doing some research there. I would say that we're in very good shape on what we're doing. I feel confident.
Maria?
Would it help if 700 staff members are being trained on the ruler program? What should parents know about this program? How will we be using that mood meter? What is it the parents should know about this program?
For Dr. Susan Bliss, for those who don't know, but I think one of the reasons we chose the program is it has a very specific parent component, and we have been talking about sending parents to Yale. There is a component where they will be trained on this and then come back and be able to talk with the other parents about all the pieces, the anchor tools, the mood meter. So one of our reasons, along with all the evidence base for Ruler, was that it did have that as a part of the program, is the involvement of parents.
There's also a team of staff at each building who are working together to talk about the process of implementation. What does it look like? You know, one of the things we're very conscious of is not rushing into things. So we are these teams of folks, and it's an administrator, teacher, a clinical staff member, some others that are together. They're meeting, they're talking, and planning out, and that's a significant part of their planning as well, to think about, you know, how do we bring folks along. At this point, the staff is just learning. You know, this is an opportunity for them to learn about, you know, we talk about Ruler, but that's really the tool that leads to the emotional intelligence and increasing their understanding and the ability to live an emotionally intelligent life in a variety of ways. So we're working with staff now, and as they develop their understanding, they'll best be able to put forward an implementation plan that's really meets the needs of all of the stakeholders in their building. And so that's even where we say we can't put a number for next year, because that work is ongoing. But we do know it's about learning that. It's about the training that's required in there.
I'd just like to add that the response from the faculty and the teachers so far has been overwhelmingly positive, and they have been very appreciative and thankful for this opportunity to have such a well-regarded and well-thought-out and well-researched program to be able to learn, and so that's been very positive. And just to note as well, I didn't mention before about the research in terms of protective factors, but the research is really showing that kids who have this social-emotional learning have a much lower chance of substance abuse and much lower chance of mental health problems. And I think that's something that, as a district, we are very concerned about. I know I just left the library earlier where they were showing a documentary on anxiety, and it was standing room only. I couldn't find a seat. So I think that's important just to mention.
Are there additional questions? Any other questions? Budget? Okay.
Just one thing.
Yeah.
I'd
Brendan.
just like to make a comment on the 2%, town body. I guess I'd call it maybe an edict around the budget. I think the 2%, first of all, it's an arbitrary number. Second, it just doesn't really factor in the realities of both kind of macroeconomics and the financial realities of the New Canaan Public Schools budget. First, from a macroeconomic perspective, if you just think about wage increases, which is most of this budget is paying for people, average wage increases right now are 2.9%. So just based on that, it would be basically a reduction in the budget to go from 2.9% to 2%. Our wage increase year over year is 1.9%. So doing better than the country as a whole. Second, if you think about the other contractual increases, we essentially have roughly 2.9% in total of the 3.5% budget increase is contractual and healthcare related. So in reality, if you're asking for a 2% year-over-year increase, you're asking for a cut in the budget because everything else is contractual, up to 2.9%. There's only a 0.5 percentage point that is really within this board's control. The rest of it is contractual, unless you're talking about significant cuts to the overall budget, which means cuts to programs. So I just personally, I don't really understand that 2%. It hasn't been well explained. Whereas if I look at this budget, the thought that's gone into it, which frankly is, beyond this year, it's the culmination of, a decade or more of work to build up, programs within the schools. There's a ton of thought that goes into that. There's a ton of diligence, as we talked about earlier. That's, I think, where the focus should be. It should not be on an arbitrary number.
Any other comments or questions? Yeah, I think just to tag on to what Brendan was saying, I think we have to put in perspective that we have a flat enrollment projected forward. I think it's also instructive to say that last year, while we came in at 167, that was because we had a really great experience that allowed us to take a reduction in our request. That's not, we can't do that every year. It's not, it's not, and we're early in the cycle. So if we can take something later on in the cycle, we'll take it. But at this point, and based on our meeting with Joe last week, I would not be confident at all in taking any reductions into our health insurance budget. So, we are looking at significant cuts to programming or increasing class sizes if we're going to look at the kind of cuts that the town boards are looking at. And I think that's when parents need to come out and say, is this the kind of education that we want in this community? Because the statistics bear out that the way this district's been run has yielded great results for the kids in this district. So. Penny?
I guess the other thing I'd like to say is I think that you look at the budget process, and really most of this is the cost of our employees that drives it. We've gone over the percentages over and over again. So when you actually think about what the budget process is, a lot of it is the union negotiations that we have. And the board works very hard at those. And if it's something you're interested in, you can try, offer to serve on the union negotiations. This last time, it's at some cost. It's at some cost in terms of your relationship with the employees when you go to arbitration. But we, as a board, the last time we negotiated, thought that we had to go to arbitration, and we did. And and that's where we are. And the numbers in this budget reflect the results of those negotiations, and we're going to go into negotiations again this summer. I know both sides will argue and fight as for what they believe is right, and we'll work out pound out another deal. But I think that the budget process here isn't just these numbers. It's really all that work that goes into getting the clean contracts that we have with our unions that allow us the flexibility to teach appropriately, and trying to get the best numbers that we can, and the best plans, the best health plans that create the right incentives for us and for the employees. So I think that the budget process shouldn't just be seen as putting together these few little numbers. It's really the work of the board all year long as we go through these issues.
Well, as an example, Joe mentioned the over $900,000 in a reduction of cost for insurance through the most recent negotiations we've been going through. Now, often that's what it is. It's not a savings, it's a reduction in cost, which is very different. So it's still moving forward, but just, those recent negotiations, that's a big number, and we do try to do everything we can to control every cost that we can. But for instance, our transportation costs, those are going to go up each year as we run the DATCO. The cost for electricity was mentioned, other things. There are many large budget items that are drivers in our budget that we do our best to maintain and to contain so that we can develop as sustainable a budget as we can. But there are factors out of our control. But you're absolutely right. It is, we're in a people business. We need kids, we need adults to teach our kids. We need people to get them here. We need people to feed them. We need people to clean the buildings. There are over 735 employees throughout the district for our 4,200 or so kids, and that's what it takes.
Any other questions? Questions on the budget? Okay. All right, well.
Well, it's some bad reading, I guess. Some nightstand reading with 76 questions, I believe. Just
You were going to read.
the 76 questions, and
I
got to 5. Well, that's all right. But please feel free, go through, and other questions, other discussions, we love to have them. So don't hesitate. Any questions that arise as a result of looking through this, we did our best to answer the question as asked, and in many places try to anticipate sort of other questions that May rise, so we tried to be as inclusive as we could. But don't hesitate to ask anything that comes up. Thank you.
Okay. All right, so we have a motion on the floor. If I could get a vote to approve as a second read the 2018-19 superintendent's budget as first moved and seconded by Mr. Hayes and Ms. West respectively on January 8th, 2018. All those in favor of the budget as presented? Any opposed? Okay. Thank you. All right, so that passes. Thank you, Dr. Lutzy, and thank you to all the staff that put in countless hours, putting this together and for your thoughtful work throughout the year. Moving on, we have our second read of the 2019-20 calendar. We have a motion on the floor for the calendar. Are there any other questions on the 2019-20 calendar before we vote?
I would just share that I haven't received feedback. I'm not sure if board members have, but if you have, certainly feel free to share.
It seemed like there was no flexibility.
It's a little tight. Yeah, it is.
Okay.
It's a tight year.
So if there are no other questions, if I could have a vote, all those in favor of the, if I could get the approval as a second read, the proposed 2019-2020 New Canaan Public School calendar as first moved and seconded by Ms. Hobbs and Ms. Richardson respectively on January 8th, 2018. All those in favor? It's unanimous. Thank you. Okay. Moving on to donation to visual and performing arts. If I could get a motion to approve a VPA donation for student chairs in the amount of $6,424.
So moved.
Penny Ration, second. Katrina, any discussion? Could you give us a little information?
Briefly,
on-
yeah, and Alan just left, unfortunately, but this is for 80 chairs for the VPA. They are student chairs, they are black. I don't have more information,
No,
I apologize.
Actually, I do
wanted
think
to-
this actually relates a little bit to the Saks
Thank you.
Auditorium project, and it is additional chairs to have in the auditorium so that it can be used as a teaching space. We had some in the budget, but it's been successful, and so they actually need even more chairs than we had put in our Saks Building Committee budget, so.
So Penny, this is parent-funded money that is being used to offset some of the requests that we would have had in the Saks Auditorium project? Or,
If he could have come to the Saks Building Committee and asked for it.
Right.
But
Okay.
I think this is an appropriate way to fund it.
Yeah.
And I'm very pleased that he chose to move it forward and really appreciate the parents have been extremely supportive of the whole Saks Auditorium project and thank them. They didn't actually specifically raise for these chairs, but I think that they will go to great use and allow much more flexibility in the auditorium.
Okay. All right, so we have a motion and a second. All those in favor? Any opposed? It's unanimous. Okay, thank you. Do we have anyone wishing to make a comment from the public? Seeing none? Dr. Letsy, announcements and future business.
Sure. So 2 weeks from tonight, we'll have a meeting. We had anticipated the tri-state report coming in, but at this point, we haven't received it, although we've been asking. They've been telling us it's on its way. So we'll keep asking, and if that's ready, we'll certainly be glad to share it with the board. Otherwise, it'll certainly be budget update as the next night on the 6th. We will be prepared to present to the joint boards of the town. It will be the Board of Finance and the Town Council together, as we've done in the past, which is a very helpful meeting, I think, for all of us, because it allows us to share with both town bodies at one meeting. So any questions that are asked, and as the presentation is unfolded, both the Town Council and the Board of Finance are well aware of discussions going forward. So we'll have some information to share with the Board of Ed prior to that as well.
All right. So if I could get a motion to adjourn. Sherry, second.
Thank see money that he.
Yes, we did. Sorry. A second? Hazel. All those in favor? It's unanimous. Thank you.